Welcome to this lecture on pricing and reimbursement. The price of a product represents the value of the product, expressed in terms of currency, for both the buyer and seller. Price contains all terms of purchase, both monetary and non-monetary, related to the product. Importantly, price is the only revenue-generating P in the marketing mix of the 4 Ps: product, place, promotion, and price. The other Ps represent expenses rather than income. Understanding price as value exchange between buyer and seller, rather than simply cost plus margin, is essential for effective pricing strategy in biomedical products. Several situations trigger pricing decisions and reviews. Setting a price for the first time at launch requires careful consideration of product and market factors. Economic changes may affect consumer demand and company cost structure. Competitor price changes raise questions about whether to follow suit. Market adjustments occur when pricing affects formulary acceptance. Political considerations have become increasingly important as pricing practices become targets of public scrutiny. Each situation requires careful analysis and response. Several key factors determine appropriate pricing. Costs including manufacturing and marketing establish the price floor, while market willingness to pay sets the ceiling. Competition and its degree in a market influence pricing objectives and strategies. Customer preferences including patient, prescriber, and payer perspectives must be considered, along with willingness and ability to pay. Channels of distribution and their margin requirements also influence pricing. Different pricing levels affect decisions including AWP, manufacturer price, and pharmacy price to patients. Companies may pursue various pricing objectives depending on their strategic situation. Achieving target return on investment or return on sales provides financial discipline to pricing decisions. Stabilizing prices by following the market leader avoids price wars and maintains industry economics. Maintaining or improving market share may require competitive pricing. Driving product utilization through accessible pricing expands the market. Maximizing profits focuses on extracting maximum value from each transaction. Pricing strategies reflect market position and competitive dynamics. Market position strategies include price leader, usually the dominant product or company that sets market pricing expectations. Price follower carefully weighs pricing moves of competition before committing to changes. Independent strategy is characterized by specialized market niches such as rare diseases or orphan drugs. Price level strategies include parity pricing to meet competition, premium pricing based on superior attributes, and discount pricing to penetrate markets. The U.S. healthcare reimbursement system is unique among industrialized nations and very complex. It is defined by providers including physicians, hospitals, clinics, pharmacies, and nursing facilities who provide healthcare services. A mix of payers including government programs and private insurance companies reimburse the providers. Employment-related insurers cover about 60% of the population. Patients share the burden through deductibles, co-pays, and self-pay. Reimbursement planning is a key early consideration for product development. Private payer types offer different balances between cost and choice. Health maintenance organizations contract with providers to offer services on fixed payment schedules, very affordable but with significant restrictions on physician availability and covered services. Preferred provider organizations are not as restrictive, offering broader options with expense management through financial incentives. Accountable care organizations emerged partly through the Affordable Care Act as consortiums sharing responsibility for defined Medicare populations. Medicare is the federal insurance program covering people over 65, disabled individuals, and those with end-stage renal disease. It is the largest single payer in the U.S. at 20% of total healthcare costs. Medicare Part A provides hospital insurance covering inpatient care. Part B provides medical insurance covering physician services and outpatient care. Part C allows beneficiaries to enroll in private health plans. Part D provides prescription drug coverage through private plans. Coverage represents the payer's determination to provide benefit for a specific product or service. It usually involves clinical, technical, and economic evaluations of an FDA-approved product or technology. CMS and Medicare decisions on coverage have significant influence over private payer decisions, though each payer has its own policies. Coverage determination is the first hurdle to market access. Without coverage, products cannot reach patients regardless of clinical merit. Coding tells the payer what was done, how it was done, and why, using standardized codes. ICD-10 codes, the International Classification of Diseases, are used for diagnoses. For procedures and services, HCPCS codes are used. HCPCS Level 1, also called CPT codes, cover physician claims. HCPCS Level 2 covers products and services outside physician offices. Different coding applies for inpatient versus outpatient settings. Coding accuracy directly affects whether providers receive appropriate reimbursement. Payment depends on the setting where service is provided. Medicare inpatient payments are based on MSDRG or Medicare Severity Diagnosis-related groups. A single payment covers all necessary services associated with that DRG. Medicare outpatient payments use APC codes or ambulatory procedure classifications. One stay may result in more than one APC payment. Physician payments use CPT codes translated through the Medicare Physician Fee Schedule. Multiple payment mechanisms apply depending on care setting. Health economics and outcomes research complements traditional clinical development information on efficacy, safety, and quality to guide decision-makers regarding patient access. HOR includes comparative effectiveness research comparing existing healthcare interventions to determine which work best. Health technology assessment systematically evaluates properties and effects of health technology including direct and indirect effects and costs. Various cost-effectiveness analyses provide economic frameworks for evaluation. The sales forecast is the basis for all budgeting and operations of the company. Because the forecast is tied to the product marketing plan, it is not an estimate under ideal conditions but is limited by key plan assumptions. Generally, forecasts are developed for a one-year period, with short-run and longer-range forecasts also developed. Different forecast types include financial forecasts, demand forecasts based on market utilization, pipeline forecasts, and production forecasts. All forecasts should be coordinated in parallel. Market factor analysis is a bottom-up approach where future sales depend on market demand factors. This is the most reliable method but also most costly. Trend analysis is top-down based on past sales with adjustments for market factors, best for stable markets. Buyer intentions surveys sample potential customers about anticipated usage. Test market trials in limited geography provide actual use data but are expensive. Executive judgment obtains opinions from senior executives, valuable combined with other methods. The forecasting department manages the process including historical data, models, and competitive data. Market research provides analytical support through primary and secondary research. Product management is ultimately responsible for achieving forecasts and accountable for accuracy. Finance manages the budget, chargebacks, rebates, and pricing estimates. Production planning manages schedules and supply issues. Coordination across all functions is essential. The product budget represents the summary of all expected expenses for a product during the marketing plan timeframe. It generally focuses on marketing, advertising, and promotion expenses. The budget is directly tied to the product forecast. Often expense levels are contingent on sales levels. The budget is represented as a line item in the product profit and loss statement. It should fully support the commercial plan while representing controllable expenses. Value-based pricing represents an emerging trend in biomedical products reimbursement. Outcomes-based contracts tie payment to actual patient outcomes rather than simply product delivery. Risk-sharing arrangements between manufacturers and payers distribute uncertainty about product performance. Real-world evidence from clinical practice supplements clinical trial data for demonstrating value. Performance guarantees in some agreements provide refunds or rebates if products fail to deliver expected results. These approaches align payment with demonstrated value. International pricing presents additional complexity for global products. Reference pricing systems in many countries tie domestic prices to prices in other markets, creating interdependencies in pricing decisions. Price corridors attempt to manage parallel trade where products flow from low-price to high-price markets. Health technology assessment requirements vary by country but increasingly influence market access. Government price negotiations are common in many markets unlike the U.S. Global pricing strategy must balance these considerations while maintaining sustainable business economics. This week examined pricing and reimbursement dynamics essential for biomedical product commercialization. Pricing reflects value exchange between buyer and seller, influenced by costs, competition, customers, and channels. The U.S. reimbursement system's complexity includes multiple payer types each with different rules. Coverage determination is the first hurdle to market access. Coding and payment mechanisms vary by care setting. Health economics and outcomes research has become increasingly important for demonstrating value and securing market access. Forecasting provides the foundation for planning and operations. Next week we examine pharmaceutical marketing strategies and tactics.